What's going on, guys? No. What's going on, boys? No, and girls, maybe. What's going on, guys? No, just checking in. I want to do a quick update on testosterone replacement therapy, my testosterone replacement therapy, and also how I'm doing on thyroid medication to treat my hypothyroidism. I'm on a T4 medication, levothyroxine, 0.05 milligrams per day, 7 days a week, anyway, and 180 milligrams of testosterone cypionate, which I split into 2 doses, separated by 4 days and then 3. 0.5 cc's 4 days later, 0.4 cc's, equaling 180 milligrams of testosterone cypionate, lowered down from 200. Are you with me? Good. Excellent. April 9th, I did a video letting you guys know that I was starting my T4 medication to treat my hypothyroidism. We just gone over my blood work and we lowered my dose. And a lot of you guys balked, at least some of you guys who I've unfortunately taken note of, thought that it was kind of a bullshit drop in dose. Well, I don't care what you think, but I still understand why you thought it, and that's fine. And so I lowered it by 10%, which was plenty for me. I'm a sensitive mofo, and I just wanted to give a quick little update saying that since I did that around April 9th, things have been going really well. So well, in fact, that it almost scares me, and part of me doesn't want to even talk about it or acknowledge it or go there because I get squeamish when things start going well. But sleep has been improved, anxiety's been improved, mood has been improved. Just since I lowered my testosterone dosage from 200 to 180 and I started levothyroxine. Now, is it a coincidence that things have been going a bit better? Quite a bit better. I'd argue that this is the most stable 6 weeks I've ever had. I just don't know, but I just don't care what's causing what. So I got a blood draw coming up, which is part of the reason I want to do a quick update and let you guys know things have just been going well, and we're going to see where my levels are at. Now, one thing that's always been an issue for me is having my E2, my estrogen levels have been a little too high, which is normal for guys who are on a dosage as high as I am for testosterone replacement therapy. When you're taking as much T as I do exogenously, your body will convert excess testosterone into estradiol. So my hope is that lowering it from 200 to 180 will have been exactly what I needed to do to get that shit in a more of a reasonable place. It wasn't terribly high on my trough day, but like my total and free testosterone, it was higher than I'd like it to be. And I've never been one to deny that I wanted good testosterone levels. Fuck being average, but I don't want to be excessive or crazy either. So my hope, based on how mentally stable I have been feeling on 180, plus adding the T4, is that things will just be looking good. And maybe I won't need to change a thing. Now, I know there's a chance that this is like a base dose of levothyroxine T4, so I know there's a chance we could go up a little bit, depending on what the blood work shows for my T3 and T4. But I'm just hoping everything looks good, and I would love to not have to change a thing. I truly would prefer that, but I'm down to tweak it, and I'm trying really hard not to overthink this. It's my nature to question the good, maybe more than the bad. So I've really been trying to just live in the moment, just express gratitude on a daily basis that things have been going pretty well, and just allow myself to enjoy it. And we will go from there. Now, if my testosterone total and free and my E2 come back a little crazy, then we will lower the dose yet again. I've always been transparent on this channel, and I've never tried to act like that's not the way I would go if I needed to go that way. So if we do this on my trough day being your low point before you're going to go ahead and take more of your said thing from me being testosterone, if the shit looks like I should lower again, then I fucking will. Because more than ever, especially experiencing some stability, mental health is all that matters. So, for anyone who's like stressed about their T therapy, because I've been stressed about this shit before, here I am, years after starting it, I feel like I'm doing better than ever, and I'm finding my sweet spot with it more than ever. Managing my symptom relief, my blood work, my side effect profile to my perfect little spot. And that's really beautiful. So I just want to give you guys an update that shit is going well, and that I'm grateful. Now, what goes up must come down. I'm not sweating it if shit gets a little bit worse. Like life is up and down. It's certainly wavy, but I'm sure glad that things are going well at the moment. I acknowledge that shit. I think that's beautiful. And I will bring you guys along for the next blood draw as well, like I did last time. We'll go over it as a team, like I did last time with Dr. Zelfan, and we will see what's what, Cuddies. But that is the update. I hope everyone's doing well. I hope you new TRT guys are staying patient. You know, it takes a while to figure out what's going to be best for you, what you're going to need, how your body's going to respond. And to you old school TRT guys, you know, I kind of feel like I'm a vet, low key. Maybe some of you guys have been on for years, but like, nah, boy, you're still early years. But you know, I've been at this for a while, and it feels good to know that even at my stage of TRT, I can adjust and see more improvements. And you know, this goes to show if the correlation to my mood and dosage change plus adding the T4 is in fact what's going on, that more does not necessarily mean better. You know, and it's become more clear to me. Nothing exceeds like excess, right? If this feels good, more should feel better. Testosterone replacement therapy, it's a tricky thing. If you're gonna mess with that stuff, your biochemistry, right? It's a tricky thing, and I've really come to respect that. You know, I've had a lot of guys reach out saying that they went up in dose, felt worse, whether their estrogen got out of control or they couldn't quite manage their like aromatase inhibitor properly with it, or they maybe had them thyroid medications out of whack, they were hyper or hypo. It's a balancing act. You really want to find a balance. You want to try not to go too crazy on any end of the spectrum, because what affects one thing can of course have a trickling effect on others. You feel me? So it feels good to be like in a place where I can just do what I need to be doing for my damn self. I'm really glad for that. I'm not fighting it. I'm not fighting it. I'm not fighting it. So don't fight it. Just figure out what's best for you and just be grateful. Not that you asked. I ain't trying to get preachy on you. I appreciate you. I hope you guys are doing well. Again, blood draw coming soon. We'll find out what's going on with the 180 dose and the level of thyroxine T4 med, and then we'll adjust from there. We'll just do this shit. We'll keep it going, fellas. Thank you for supporting my journey. Thank you for a lot of you reaching out, letting me allowing me to be a part of yours. You know, I love that. I think that's badass. I appreciate you. We'll see you guys in the next video. Take good motherfucking care of yourself, boys. Peace.